Thank you for joining us here today. My guest is Dr. Megan Hood, clinical psychologist of Rush University Medical Center, who is, I'd like to say, my therapist, if that's okay, for a pain study that I'm involved in. So, Dr. Hood, what I'd like you to do is just tell us a little bit about yourself and how you got started and what this means to you.
Sure, I'd be happy to. So, as you mentioned, I'm a clinical psychologist here at Rush, and my specialty area is working with patients with chronic health conditions. So that means either chronic pain or other health conditions like diabetes or obesity, things along those lines. And I'm really passionate about those areas because I recognize the degree of stress that having those conditions can cause for people, but also the role that having increased stress can have on the experience of those conditions. So that's one of the ways I got involved in this research study. So I'm a therapist on the study, meaning I provide the intervention for the study. And the intervention we worked on together was a mindfulness intervention. And I've been leading mindfulness interventions for, 5 or 6 years or so now.
Wow.
Yeah. Which I came to as a stress management strategy. Mindfulness can be approached in a variety of ways, but given my job and my role here, that's the way I initially kind of came into mindfulness work.
Okay. Now, did you have any experiences as a kid that kind of led you in this direction, and why did you choose this field?
It's a good question. I would say I was a pretty active kid. I was in a lot of sports, so I think in terms of being kind of connected with my body, that was maybe, especially as a kid, the way I was more mindful of noticing, did what I eat made a difference in how well I played soccer that day or something along those lines. I wasn't probably as aware of the role of my thoughts and how that affected my emotions and things like that until I became more of an adult. But I didn't have much exposure to mindfulness meditation as a child, and even in terms of like yoga or things along those lines, which I think is becoming more common these days. But just wasn't really a part of my upbringing until really probably into my 20s and 30s.
Now, it's strange, well, not strange, but it's interesting that you would say diabetes, because I was a diabetic also, and how that played into stress. And you just don't think of stress when you think diabetes.
Interesting.
So what would you say to someone who is having pain, back pain or overall pain, intense pain like I was until I learned some techniques from you here. What would you say to someone who is also a diabetic or may or not be a diabetic, but they're having intense pain as I was having?
So, I think from the mindfulness perspective, an important thing to recognize is that those experiences are normal. That it's normal for us to have stress related to trying to manage our diabetes. It's normal for us to have stress related to our pain, and our minds are naturally going to go to those things when we're feeling upset. So if I'm having a flare of my pain, it's natural for my mind to keep focusing back on that pain. Or if I'm noticing that it's stressful for me to have to check my sugars regularly, it's normal for that to be upsetting for some people. That's what we call autopilot. It's what we are doing naturally, right? Our brains are trained to go to that, because the idea is if I keep focusing on my pain, maybe I can find a solution for it. But when we know that I have to keep checking my sugars, and I've done everything I can to manage my pain, then being on autopilot isn't as productive for us. It actually just increases our stress. So mindfulness techniques can be beneficial because they give people these skills, as we've talked about and as you've learned, to help separate themselves a little bit from the experience, be able to label those experiences as just thoughts, just emotions, or importantly, just physical sensations, that we can choose how we want to kind of redirect our attention, or if we want to at the time. I think that can be a really powerful aspect of mindfulness.
Hey, this is Mike Warren. I'm a business flipping expert and business maverick, and I just attended Zelda Robinson's event where she talked about really what's called mindfulness and stress reduction, and how to create blueprints and breakthroughs so that you can really control your life better. And I have to say, I was totally impressed. These are some techniques I want to apply in my own life. I want to pass it on to my employees as well as the other companies that we own, because we own several different private equity companies and multiple companies underneath that as well. And I think the techniques that she's sharing apply to everybody in every type of situation. So what I would like to just say is, if you get the chance to go see Zelda, I highly encourage you to go in and listen to what she has, get her program, and take those techniques, apply it in your life, and you will absolutely not regret a single bit of it. So good luck with that, and I'll see you on the other side.